So I just want to sort of jump straight into the session. We're going to be talking about bioidentical hormone therapy. If you want to jump in with a question, please do let sort of Deborah finish the bit that she's working on. But if there's a question you have, jump in. It's an informal session, and we'll also take some questions at the end. So let me introduce Deborah. She's a board certified nurse practitioner with a doctorate in nursing. She's a certified bioidentical hormone provider. So please welcome Dr. Deborah Wainwright.
Thanks, Chris. Well, welcome everybody. Thanks for coming today. I know this is a strange time and we're, getting together via Zoom, but it's, I think it's going to work really well. So again, thanks for coming. And I'm just going to try to help those who are wanting some more information about hormone therapy. And like Chris said, if you have any questions, please don't hesitate to ask. So the first question really is what is bioidentical hormone therapy? And really that it can be given either in a pellet or in a cream. Bioidentical hormones are derived from the yam, and I'll go over the difference between hormones because I'm sure many people have heard HRT or hormone therapy and they have different opinions on it. So like I said, hormones can be given via a cream where you would apply it yourself every morning, or in a pellet application where that would be something I would do in the office, and I'll go over that more. Hormones have been around, bioidenticals have been around for over 80 years, so they're certainly not new. And there has been dozens and dozens of studies. There's plenty of evidence-based literature and research done on hormone therapy. So they are safe and they're effective. They work really, really well. It's just there's not a lot of, unfortunately, when people Google hormone therapy, they read about the synthetic hormones and they get nervous and scared. And unfortunately, there are people in the medical community that don't know the difference, and that's totally fine. So I'll decipher the difference between synthetic and bioidentical. Does anybody have any questions so far? No? Okay. All right. So the benefits of bioidentical hormones. Well, most people will, when they call the office or they're thinking about trying hormones, they're typically experiencing symptoms of low energy, mood changes, maybe headaches and sleep disturbances, waking through the night. Their sense of well-being has lessened and they just don't feel themselves. Some will experience hot flashes, night sweats, loss of libido, loss of sex drive, or loss of interest. And certainly, particularly also with men, is they can experience erectile dysfunction, loss of muscle tone, and certainly loss of memory and poor focus. So these are some really typical symptoms that people will start to notice, and which leads to them, or which leads them into calling the office or starting to research hormone therapy. So there are really dozens of different symptoms that can be related to hormone deficiency. So if you're feeling any of these symptoms or you think that something's changing, it's probably a great time to have some labs done. Hormones, the deficiency in hormones start to drop in our late 30s, particularly when we get into our 40s, and certainly when women enter the perimenopause phase or postmenopausal phase. And then men also go through something similar, such as andropause, which is a loss of testosterone. So I don't want men to think that hormone therapy is just for women. It's really, really important that if men are feeling these symptoms, that they get their testosterone levels checked. So just talking about those surface symptoms that I just mentioned, I also want to let people know that hormones are really so important because they're working at the cellular level. It's not something we necessarily feel, but hormones really are the building blocks of our body, and they literally signal all of our cells to function properly. So really they go to those receptor sites that are deficient and they make the cell work properly. So it's really important to consider hormones, certainly when you get into your, late 40s, early 50s. And if you're wondering, what that all means, it's, well, when you think of osteoporosis, sorry, there's a plane flying overhead. Let's wait for that to pass. Osteoporosis, loss of bone, neurodegenerative disease such as Alzheimer's and Parkinson's, loss of muscle, increased cancer risk. So when there's a hormone deficiency, women are certainly more at risk for developing uterine cancer and breast cancer, and for men, they're at risk for developing prostate cancer. Hormones also help. Sorry, go ahead, Chris.
So on that, there's a question that if someone's had breast cancer, say 15 years ago, would they qualify therefore for hormone therapy, or what would be the considerations in that case?
They would. Typically we wait 5 years, and then they would also, just want to make sure that they talk to their primary care doctor or their oncologist to make sure that they're on board. It's a collaborative agreement, or decision. But typically it's a 5-year waiting period once the patient's gone through that.
Okay.
In fact, it's, studies have shown that you're more protected once you get on the bioidentical hormones at preventing the recurrence of disease.
Fantastic. Going back a little bit, you also mentioned sort of a panel in terms of the blood work. I know we've spoken about this in private conversations many times, but perhaps you could just expand on what that panel does, what that panel shows, because I know that's kind of the starting point as well in terms of considering this. What do you get from doing that panel?
Well, it's a serum panel, so it's a blood test, and we will draw several different hormones. So we're looking at estrogen levels, testosterone levels, progesterone, cortisol, DHEA. We're looking at thyroid hormone. So there's several different blood tests that can be done prior to the program. So, and that's really the starting point. We have to see, you sort of fall into a category in a way where you're experiencing symptoms, you're within the age range, and it's been going on for a certain amount of time. So it's probably a good time to maybe have it tested. If it's a situation where you're really not feeling well. And I think it's a great idea too, just to have a baseline. If you're curious, if you're 35 and I wonder where my hormones are sitting, it's nice to have a baseline, and you can sort of track it and do it again at 40 and so forth. So going back to how the hormones really work at that cell level, other evidence has shown that hormones really do help protect against cardiovascular disease and diabetes and those age-related diseases. So it's not just, I have so many patients come in and say, well, I don't have any night sweats, or I don't have hot flashes, or I'm not really feeling this, so I guess I don't need hormones. And that's just not true. I really try to direct patients to, really what it's going to do in the long run. It's really, hormones are about longevity and vitality, and not necessarily stopping the aging process, but it's really slowing or reducing the risk of those age-related diseases. So it's important for people to think about, how they want to feel and where they want to be when they're in their 50s, 60s, and 70s. We don't necessarily want to age like our parents. Maybe we have parents and grandparents that we've seen age and have been, diagnosed with several different, disease processes, and they're on a lot of different medications. Hormones can really do a lot to impact that and prevent those diseases. So it's just more about those surface symptoms. Any questions so far? No. Okay. So next item is why would I use bioidentical hormones? Well, really, it's, going back to the same, it's all about prevention. It's preventing the cancers. It's preventing the memory loss. It's preventing the brain atrophy. It's preventing the that loss of yourself. So really, like I say, if you're over the age of 40 and you're starting to at least feel those symptoms, I highly recommend coming into COI and having the blood work done. We'd be more than happy to sit down and talk to you. It's a complimentary consultation, and we'll just sit and talk together and figure out what's going on. And if it's something that you're interested in doing, we could certainly do the hormone panel and see where you're sitting. But all right. And so let's talk about the difference. Chris, do you have anything else you want to talk about?
No, I'm good so far. Thank you.
You're good. Okay. The difference between the one thing that people tend to ask is what are hormones and what's the difference between synthetic hormones and the bioidentical hormones. Synthetic hormones are derived from pregnant horse urine. And I know that sounds not so nice, but they were manufactured by Big Pharma. And that's sort of what became the standard of care, certainly in the 90s. And it really took a turn for the worse because people and women started to develop breast cancer, started having heart attacks and strokes. So they were pulled from the market. And a lot of that literature is still out there. And honestly, they really still are not safe. I wouldn't recommend them, and I don't prescribe them. These hormones derived from pregnant horse urine are really not a molecular match to the human hormone. So it's when patients take these hormones, a lot of wrong things happen in the body, and they're really just not safe. So that's synthetic hormones. You'll read a lot about that online, and a lot of people are really nervous to use them. Certainly I would be too. Bioidentical hormones are derived from the yam, the wild Mexican yam, and they actually are their molecular structure is identical, and that's why you get the term bioidentical. They are a match to the human hormones. So when you do use bioidentical hormones, your body does not recognizes them as their own endogenous hormones. Your body just keeps doing its thing and performing like it should. So there's no contraindication. There's no things that happen that would cause harm or would cause you to feel or become sick. So that's really important. Bioidentical hormones are natural, so they exist in nature and they cannot be patented by the big pharmaceutical companies. So they're really if something can't be be a big money maker, then they're really not sort of looked upon as something to use. Whereas the patentable synthetic hormones are, sort of, that's what Big Pharma promotes. And that's what, unfortunately, medicine promotes. When you go see your family doctor, that's what they're accustomed to using. So unfortunately, there's not a lot of training in medical school about synthetic and bioidenticals. So it's really difficult to expect maybe your family doctor to know the difference. And if it's something that they're not interested in doing or using, then a lot of times you'll have pushback. So I recommend going to see, somebody that works in functional medicine, someone like myself, someone that is really, that practices with bioidentical hormones and understands the literature to help you make a decision. But certainly using the yam-based hormones they're effective and they're safe. So, and you can use them for a long period of time. So the most common symptoms that when people come into the office, in what may bring you into the office, really are the loss of energy, not feeling well, maybe not sleeping, depression, anxiety, mood swings or mood changes, palpitations, headaches, very common. Hot flashes and night sweats really are the first symptom that women, certainly in their late 40s, will come in complaining about. Certainly vaginal dryness and painful intercourse is a big problem. And then just chronic fatigue, loss of muscle tone, not feeling like they want to work out or not seeing results when they do work out. So those are really the most common complaints that I see at the office. So you're feeling like that, I would recommend coming in to, to have a talk. I've touched on this a little bit. I just want people to know, and I certainly want men to know, that bioidentical hormone therapy isn't just for women. It's certainly, I do see a lot of men in the practice. Men are certainly in the same situation as they age. They lose testosterone, and they may start to notice that they're feeling depressed or anxious. They're not sleeping well. They could even have night sweats and hot flashes. They may not be, their workouts at the gym may not be as good. And certainly the loss of interest in being intimate with their partner and erectile dysfunction is really, can be detrimental to men. So it's not just for women. And I just want the men out there to know that they can come in and have their labs tested. But I'd really like to talk about the pellets, because they're really my favorite form of bioidenticals. Like I mentioned earlier in the chat, creams are wonderful. I'm really happy if people want to do bioidentical creams. It's better than not doing any hormone at all. So creams can really be effective. However, you have to apply them every day. So they're something that you put on every morning. Typically, it's an estrogen for women and a testosterone cream, and then men would use the testosterone cream. So that's applied every single day. And then progesterone, which is really our mood hormone, it's our sleep hormone. Progesterone is really known as an anti-inflammatory and a natural diuretic, and just really a feel-good hormone. That's given orally. So you would take that at bedtime, and all women take progesterone. So creams are wonderful. If you're good at remembering and you're okay putting something on every morning and you won't forget, then certainly you'll start to feel better. But unfortunately, cream doesn't really get to those optimal levels. It's just not, it's more of a one size fits all therapy. And it's just, you have to be really diligent in putting these creams on every morning. The pellet therapy is wonderful just because it's implanted. So it's a pellet implant. It's a pressed hormone powder, and you'd come into the office, and it's a quick, minor procedure. It's done with numbing a little area up on the back side, sort of the upper outer quadrant of the hip. You get numbed up with a little bit of lidocaine, and then the pellet's implanted. And for men, it's just testosterone, and for women, it's estrogen and the testosterone. It's nice because these pellets, once they're implanted, they usually last 2 to 3 months. Sometimes they last 4 to 5 months, just depending. And it's not a one size fits all. I personally will, look at your labs and discuss with you the dose that you may need. And then those pellets are implanted and they last a period of time. So you don't have to really remember anything. And because they're sitting in the fatty tissue, they're dissolving and they're going directly into the bloodstream. So you get these nicer levels, optimal levels. And that's really what we want. You don't want just a sprinkle, because the sprinkle may take away the surface symptoms, but they're not going to really hit at that cell level. You really want those nice optimal levels. And that's what we can achieve with pellet therapy. So over the years, I've been doing this a long time, and I've seen many, many patients doing creams that end up at my practice, where they're saying, hey, I've been doing these creams for a while and I'm just not noticing a difference. I'm still sort of feeling like I did when I started. And then I convert them onto pellets, and they just, for so many, it's been life-changing. I've just seen so many people really just turn their life around and just feel wonderful and sort of get back to their old self. So I personally like the pellet therapy. It's, like I said, it's done in the office. It's an implant, and it works wonderful. So highly recommend that way of getting the bioidentical hormones.
So let's open it to everyone in terms of any questions that you have. Just to reiterate, we are recording, so I don't want you to get too personal. And as Dr. Wainwright said, if you want to get into more specifics in terms of you, then connect with the office, and it's a 30-minute free consultation with Dr. Wainwright, so you can get very sort of personal there. But any questions from anyone in terms of what's been sort of spoken about so far? So from my point of view, you mentioned it sort of, I think you said implanted into the fatty tissue. Could you tell us a little bit more about what you're talking about there? Because, you know, where's it going? And
Right.
this is going to hurt me.
Right. It does sound a little scary, but no, it's a small amount of lidocaine that's on sort of the backside of your hip. So you wouldn't lie on it, but on the backside of your hip under the belt line, there's a nice little fat pad, as we call, and I put a little bit of lidocaine in there, and then a very, very small incision. So it's just to open the skin. So there's no large incision. I make a tiny, tiny incision. And I have a special instrument where I can insert it into that fat pad. And these pellets are very, very small. For men, I would say picture a white Tic Tac, a little bit, maybe a little more narrow than a Tic Tac, maybe a little shorter. And they have several of those pellets placed in that fatty pad. For women, they have the estradiol and the testosterone pellets are very, very small. So you really don't feel anything. Once you're numb, the incision's made, the pellets are implanted, they sit nicely in that subcutaneous tissue, and then they dissolve over a period of time. So, and they work really when your heart rate goes up. So if you're working out or you're doing something vigorous or you're walking or hiking or doing whatever, you're going to have more of that hormone released. But when you're sleeping and you're a little bit more sedentary, you're not getting these big bursts of the hormones. So it's really a nice balance. The incision's closed up with little wound closure strips or little butterfly tapes. So the odd person may have a little reaction, and I can put in a little stitch, but that's not common. It's really just the little wound closure strips, and that incision closes in about 3 to 4 days. So very simple procedure done in the office. You can go back to work. And you can go back to normal activity. The only thing that I really say is, as for vigorous lower body workouts, I would just take a break for a few days. Just want those pellets to sort of settle in and let the incision close nicely. So, but really no downtime. And once it's done, it's done. You don't have to apply something every morning, which is great. It's convenient and you feel good. So you're not having these ups and downs with creams. It's putting that cream on in the morning. You do it Monday, Tuesday, and then you forget Wednesday, Thursday, and you start feeling not so good. And then you realize, oh, I didn't put my creams on. And then you start, you're kind of always chasing that relief. Whereas the hormone, once it's implanted, and I'm not using large doses right off the the top. It's a nice low and slow program. We do your labs. We look at levels. I dose conservatively, certainly in the beginning, to see how you respond. And then you do repeat follow-up labs, and we see where you are then, and then we dose again. So it's very well controlled, and you just eat, like I say, you get these nice optimal levels, and you're not chasing that feeling of getting better or just having those symptoms be gone.
Any final questions? Any questions at all?
Kim, what other range is good for taking?
That one's been answered. The one.
Yeah. What age range? Oh, hi.
Sorry.
Thanks for the question. I really, like I said, the levels start to drop in our 30s, but most people will be coming into the office in their 40s. 45 and older is really sort of the main age range. Certain people may have had an early hysterectomy or early ovarian failure or whatever reason, but that would be, still come on in and we can talk about it and see if you're a candidate for hormones. Again, we're not trying to replace hormones for people that already have nice levels or that are, naturally still cycling or naturally having their hormone levels. It's not ideal for someone that's in their 20s that have decent hormone levels. It's really, more for people that are starting to have that decline.
Any final questions? You can either come off mute and ask or type them up. Okay, so final question from me then is, how would I get started? You know, if I was looking to get onto this regime, you know, what would I do?
Thanks, Chris. Certainly, just call Coy and ask to come on my schedule for a free consultation, a complimentary consultation. And if you're comfortable doing that, we are still open at Coy. We are wearing all the protective PPE, gloves and masks and so forth. And we are certainly keeping everything tidy and sanitized. So if you're comfortable coming in to see me, I can certainly meet you, or I'd be more than happy to do a Zoom consultation. That would be fine too. So we would do that. And then at that time, after we meet and discuss everything, then the next step would really be about doing lab work. We do have nurses at Coy that can draw your labs, or you could go to a LabCorp. So that would be the next step. And then it would be, again, talking and going over your labs and doing a follow-up visit and deciding if you want to do pellet therapy or if you want to get onto the Bio Identical creams. So, and we would discuss that together. So it's about, you know, starting with calling Coy and doing a consultation with me.
And just to reiterate that, there's a couple of things there. One, it can be done face to face, but understand with the current situation, we can do it via a Zoom call. Obviously, when you come to do the blood, that would be a physical thing, but that can be managed.
Right.
Again, is there an age limit to start is a question.
I would say somebody in their mid-30s and up. That would be the best age range. Anyone younger than that, again, there could be underlying medical history, so it would still be fine to come in and have a consultation, but there would be no guarantee that they would necessarily need hormone replacement. However, if they would be interested in doing lab work just for baseline purposes and having something to look at and compare to as they get older, that would be fine too. So really, you know, if you are curious and you have questions, I'd be more than happy to talk to you.
Yeah, just to reiterate, this is the purpose of this was to sort of share at a general level, but clearly when you want to get into specifics about you, as Dr. Wainwright said, just reach out with the office and take advantage of that free consultation and get into some more detail on a one-to-one.
Right.
I'm not seeing any more questions come up, so thank you everyone for joining. I hope this has been useful. This is the first time we've done something like this, so we wanted to sort of give it a go, especially at this time, and start talking about something that's very important. And thank you, Dr. Wainwright, for again such knowledge and insight. So thank you all. Look forward to seeing you all in better times soon.
Right. Thanks, everyone.